Hello, my name is Mindy Mestis, and I would like to thank you for joining me for this presentation. During this presentation, I will be addressing a board of individuals that are responsible for helping with the implementation of quality care issues within the NICU. Along with this presentation, I have also included a slide presentation to help provide guidance so that consistent information can be presented to everyone that is associated for this presentation. The area that I would like to address is pain in both premature and full-term babies that have been admitted into the NICU. My quality care issue and proposal is for the NICU that is located in Boise, Idaho at St. Alphonsus Regional Medical Care Center to change their current standard of care for pain management, which is swaddling and confinement, to actually begin utilizing sucrose and non-nutritive sucking to help decrease pain and suffering during painful procedures for premature babies and infants while in the NICU. The people that I will be presenting this to will be the organizational board that makes decisions for the NICU. This board consists of the unit managers, the director of Women's and Children's Department, the NICU pharmacy, which consists of 4 pharmacists, as well as the neonatal physicians. I would also encourage charge nurses to attend this presentation as they can help assist staff with changing within the unit. Often change is difficult to accept, and with guidance from mentors, this inspiration can facilitate change and hopefully empower others to follow the change. Facts. Neonates who are being cared for in the NICU, unfortunately they are exposed to painful procedures each and every day. These procedures are necessary, however, they are detrimental to their brain as well as their developmental milestones as they go on throughout their lives. Pain is looked upon in the NICU as the 6th vital sign. It is monitored with every set of cares, pre as well as post procedures. However, this isn't necessarily done correctly, as staff isn't clear on what exactly they're writing down. An environment needs to be created that supports and promotes a sense of security both physically and emotionally for babies that are residing in the NICU. Pain needs to be addressed individually, as pain is experienced at different levels for each baby. With babies, they show pain in different ways. They have all their vital signs change: their heart rate, their respiratory rate, their blood pressure, as well as their intracranial pressure changes. Studies show that it takes 20 minutes for a baby to recover from just being turned over for an assessment. They have changes such as in their skin color, they have nausea, they have projectile vomiting, and they have dilated pupils. Premature micro babies have anxiety, sensitivity to light, to touch, and noise, which is demonstrated by a loss of vagal tone, oxygen saturation issues, as well as a change in blood pressure. This eventually tires the baby out, and therefore they're unable to breastfeed, bottle feed, be interactive when their parents are at the bedside, which also can hinder the bonding experience that happens between parents and their babies. Painful procedures that we are talking about that happen on a daily basis can range from heel lancing to venipuncture to IV insertion, restraining babies during procedures. Simply putting an NG tube down their nares is a painful procedure. If something was to be placed down your nose, I'm sure that you would not feel comfortable with this occurring. You have more serious procedures that occur, such as lumbar puncturing, ET suctioning, as well as being intubated. A lot of times while babies are intubated, they are not sedated in the NICU. Of course, you also have umbilical line placements as well as circumcisions that are done while babies are in the NICU. My proposal is for sucrose to start being utilized, as evidence-based practice strongly suggests that there is a definite link between sucrose and helping comfort a child. Sucrose is a sweet disaccharide that has been used for generations to soothe and calm distressed neonates. This occurs when it is exposed to the oral mucosa for absorption, which induces the release of the release of opioid reactions within the baby. It's not meant to be digested, it's meant to be absorbed within the mouth, which actually has analgesic results similar to actually reported as Tylenol. The benefits of using this is that it's very systemic and the results are rapid, they're enduring, and the procedure, if you administer sucrose 1 to 2 minutes prior to the procedure, the baby remains calm and is able to be soothed, and there are times actually that the baby does not even cry while a procedure is being done. Dosing depends upon the gestation of the infant. Obviously, the smaller they are, the smaller the dose. Studies are showing 27 to 37 weeks normally get 0.2 to 0.4 mils orally per procedure, and 37 to 44 weeks get up to 2 mils orally. This is consistently given with a pacifier, as this also helps take their mind off of what is going on. And helps create saliva, so this is actually helping the analgesia continue to work. Of course, there is caution with the use of sucrose. As a child is hyperglycemic, you're going to want to monitor how much of sucrose you are giving them. Thoughts to consider: you want to make sure that you're giving the right dosage, as you don't want to give them too much, especially if they're intubated, as there is a chance of aspiration. And as I mentioned before, there is no benefit for this medication to reach their gastric area, as it is not absorbed gastrically, as it will not promote analgesic results from this. My plan for hopefully implementation of this quality care issue is to form a multidisciplinary pain management team, which would consist of nurses, doctors, pharmacists, occupational and speech therapists, as well as social workers and case managers, as they have great relationships with parents, and they can also encourage parents to participate with this. Educate staff about the sucrose and its analgesic effects. Encourage them to be proactive, encourage them to accept change, and provide them with evidence-based practice information, as data is hard to dispute. Also, the next step would be to develop a policy and procedure for the administration of sucrose, and also encourage staff to utilize the parents with this, as parents often know their babies better than staff does. In conclusion, I really would like to thank you for taking the time to consider my quality care issue, as I feel that we need to strongly create a pain-free environment for our patients. We need to be their voice, and we need to treat them as we would like to be treated. Thank you very much, and I appreciate you taking the time to listen to my presentation, and I hope that you have all learned something from this.